Hey, I'm gonna be sharing on schizoaffective disorder today. I had a hard time understanding this diagnosis, but I think I finally get it. Not completely, but I think I understand the foundation of it. So yeah, I'm gonna share that with you. Yeah, in the hopes of making it easier for you to understand it too. If you may be struggling to just really get it after reading the DSM-5-TR. That's what I'm gonna be using. It's my source. Yeah, I basically summarized the information. So yeah, let's get into it. So I'm gonna start off with the diagnostic criteria. So I have four of these. I think there might be more in the DSM, but I just took out like the major important just so I understand the diagnosis. So I'm gonna start off with A, right? It's an uninterrupted period of illness during which there is a major mood episode. Mood episodes are so important when it comes to schizoaffective disorder. They're like, I don't know. I don't know whether to say they're the father, the mother, but they're a core parent. Like they're primary, right? There has to be a major mood episode. Now this major mood episode could either be depressive or manic. Okay, so just remember that your first A, there has to be a major mood episode, and it can either be depressive or manic. And then another key thing, it has to be concurrent with criterion A of schizophrenia. I will state what criterion A of schizophrenia is. So it has to be concurrent with criterion A of schizophrenia, which has 5 items. So 2 or more of the following, each present for a significant portion of time during a 1 month period or less if treatment has been successful, right? So out of these 5, at least one of these has to be the first 3 that I'm going to mention, which are delusions, hallucinations, disorganized speech, for example, frequent derailment or incoherence. So when you at least have one of these, then you can either have the grossly disorganized or catatonic behavior, negative symptoms, which is your diminished emotional expression, or your avolition. Avolition is a lack of initiative or goals. Yeah. So, and I think you can also even have like, you don't just need to say, oh, I just need delusions and then 4 and 5. I think you can even have delusions, hallucinations plus 4 and 5. It just says you need 2 or more of these 5, and at least one of those 2 or more has to be the first 3. Okay, so that's criterion A of schizophrenia, and it has to be concurrent with a major mood episode, and that's criteria A, diagnostic criteria A of schizoaffective disorder. And now we move on to the B part of it, delusions or hallucinations for 2 or more weeks in the absence of a major mood episode. This is the other primary key factor. You know how I say like a mood episode is so important in this diagnosis, right? And also the absence of a mood episode when you are having delusions and hallucinations for at least 2 weeks is very important. It's like what separates it from all the other disorders, okay. Then the C part of it, symptoms that meet criteria for a major mood episode are present for the majority of the total duration. Like I was saying, the mood episode is very key, and it's the dominant feature, let's say, because you notice there are also psychotic features involved like delusions, hallucinations, but the mood episode is like it has more of an influence when we make this diagnosis, right? And then the D part of the criteria, do not whatever is happening to the person should not be attributed to drugs or medication or any other medical condition, right? So just remember that. And then here you have to specify whether it's bipolar type or depressive type. If there is a combination of mania and depression, then it's officially automatically a bipolar type of schizoaffective disorder. If there is just a depressive, no mania, then it is just a depressive type, right? And then you can also specify if there's catatonia. Catatonia is simply put being in a rigid, non-active state, just, yeah. And then diagnostic features. So now I'm explaining the A to D criteria that I mentioned earlier. I'm just going to be adding a little bit more flesh into them. So at some time during the period, criterion A for schizophrenia has to be met. Okay, like you cannot say someone has schizoaffective disorder if they've never met criterion A of schizophrenia. So remember criterion A, which I said it has 5 items, and then at least one of those 5 items has to be delusion, either delusions, hallucination, or disorganized speech, right? At least one, and then you can include all the other, the remaining 2 are grossly disorganized behavior or catatonic behavior or negative symptoms, right? And then criterion B of this whole thing refers to social dysfunction. This is when you are having those delusions and hallucinations, but in the absence of a major mood disorder. So this will obviously affect your social functioning, like work and stuff like that. Criterion C, which refers to the mood aspect of it, at least, there should at least be like a 6-month duration of these mood episodes, right? In addition to criterion A for schizophrenia, there is a major mood episode, so either major depressive or manic, right? Criterion A for schizoaffective disorder, right? So you have your mood episode, right? This is basically the first part of the criterion A without the in addition to meeting criterion A for schizophrenia, yes, you need the mood episode. They have to be together. So remember how I first mentioned that criterion A, at some point you need criterion A of schizophrenia, and at the same time you also need, when this is happening, there should also be a mood episode, right? So because loss of interest or pleasure is common in schizophrenia, to meet criterion A for schizoaffective disorder, the major depressive episode must include pervasive depressed mood. So that's pervasive depressed mood. That's like your continuous long-term form of depression, basically affecting all areas of one's life. It's important. And then episodes of depression or mania are present for the majority of the total duration of the episode, right? So yeah, i.e. after criterion A has been met, criterion C for schizophrenia. Okay, so just remember that, right? This is important. The mood episodes are important when we diagnose this disorder. So to separate schizoaffective disorder from a depressive or bipolar disorder with psychotic features, I think I just want to go back to the previous point. So I said episodes of depression or mania are present for the majority of the total duration of the illness. After criterion A has been met, criterion A, you need a mood disorder and you need schizophrenia. Criterion A of schizophrenia happening at the same time, and you need at least having like mood episodes for at least 6 months. Criterion C, right? Okay, and then once that's combined, for the majority of the illness, there should be episodes of mood episodes, either depression or mania. Okay, just wanted to clarify that. Okay, next point. To separate schizophrenia disorder from a depressive or bipolar disorder with psychotic features, because these are the other 2 types of disorders you could confuse with when making a diagnosis. Delusions or hallucinations must be present for at least 2 weeks in the absence of a major mood episode, right? I mentioned this earlier. And then criterion C for schizoaffective disorder specifies that mood symptoms meeting criteria for a major mood episode must be present for the majority of the total duration of the active and residual. Okay, so for this point, I'll try read it slowly and explain in bits because it also confused me, but I slowly got it. So the other point of diagnostic features, focusing on criterion C for schizoaffective disorder, specifies that the mood symptoms meeting criteria for a major mood episode must be present for the majority of the total duration of the active and residual portion of the illness, right? So criterion C requires that the whole mood episodes should be happening for at least 6 months, right? And then once that's achieved, criterion C requires the assessment of mood symptoms for the entire lifetime course of a psychotic illness. So it's like the majority, the major mood, right? It's like the core primary. It's like the foundation. Yeah, the foundation of the disorder. If the mood symptoms are present for only a brief period, right, the diagnosis ends up being schizophrenia and not schizoaffective. So it's only schizoaffective if the foundation of these if the foundation of person is a mood disorder, like it has to be a mood disorder and it's long term. The moment that this mood disorder is short term, then no, this person has schizophrenia instead. Yeah. Associated, I said if it's short term, if the mood episodes are present for short term, then this person has schizophrenia instead, right? Associated features, right? Individuals with schizoaffective disorder may be at increased risk for later developing. They can later on develop major depressive disorder or bipolar disorder if mood symptoms continue following the remission of symptoms meeting criteria A for schizophrenia. So these are your psychotic symptoms, hey? So now you only experience your mood disorders, right? But you no longer have delusions, hallucinations, or disorganized speech. You don't have those. Basically the 5 catatonia, I'm not remembering everything, but those 5 I mentioned earlier, you no longer have those altogether, but you still have mood disorder. So with time, that can then be changed to either you have major depressive disorder or you have bipolar, right? And then another point under associated features that's important is schizoaffective disorder is often characterized by gray matter volume loss. It's always characterized by gray matter volume loss on brain imaging. So in the same way as is with schizophrenia, that is if they do a neuropsychological test, right? Development and course. So the typical onset of schizoaffective disorder is your early childhood, although onset can occur anytime from when you're an adolescent to late in life, right? A significant number of individuals diagnosed with another psychotic illness initially will receive the diagnosis schizoaffective disorder later when the pattern of mood episodes has become more apparent, right? So maybe you can start off with just a significant number of Individuals diagnosed with another psychotic illness initially will receive the diagnosis schizoaffective disorder later when the pattern of mood disorder has become more apparent. Remember, because this diagnosis, it's a combination of mood and psychotic features, but it's all, the key factors, like it's all dependent usually on the duration. Like the duration is the what really then defines whether it's schizoaffective or if it's just something else, right? Become more apparent, whereas others may be diagnosed with mood disorders before independent psychotic symptoms are detected, right? Conversely, some individuals will have change in diagnosis from schizoaffective disorder to a mood disorder or to schizophrenia over time. A change in diagnosis from schizoaffective disorder to schizophrenia was more common than a change to mood disorder. So I guess maybe the psychotic features may become more, apparent, I would say, than the mood features. Risk and prognostic factors. So yes, there are genetic and physiological aspects to be looked into when looking into this disorder. So among individuals with schizophrenia, there is a risk of their first degree relatives getting schizoaffective disorder. So they'll have family members, they may not necessarily get schizophrenia themselves too, but they can have schizoaffective disorder. And then it's also the same, like if someone has schizoaffective disorder in the family, then another member is also likely to get schizoaffective disorder, or like even bipolar. They can also have bipolar and not schizoaffective disorder itself. There's a 5% risk when it comes to suicide, and suicide is more apparent for those who have schizoaffective disorder with the major depressive type. So those with the manic type, the bipolar type, may not, especially if it's just pure mania, they are not at a greater risk of suicide than those who have the depressive type of it. And yes, there are functional consequences like we mentioned earlier, but dysfunction is not a diagnostic criterion for schizoaffective disorder as it is for schizophrenia. So I think the moment you have a patient that is really dysfunctioning, like dysfunction is like a dominant factor, then you probably want to put aside schizoaffective disorder and maybe pay more attention to, say, schizophrenia. And then differential diagnosis, we have your schizophrenia, bipolar, and depressive disorders. So just bear in mind that distinguishing schizoaffective disorder from schizophrenia and from depressive and bipolar disorders, it's difficult. Like, it's not easy. It's a bit tricky. So let's see, criterion C is designed to separate schizoaffective disorder from schizophrenia because of the duration of the the mood. So like with schizoaffective disorder, you need a long-term period, 6 months plus, of mood disorder. With schizophrenia, it can be less. I would say schizophrenia, the dominant is more the psychotic, the mood is there, but it's not as dominant. And then criterion B is designed to distinguish schizoaffective disorder from depressive or bipolar features with psychotic features. If I'm not mistaken, I'll put it on the screen, but if I'm not mistaken, criterion B is when you have those like psychotic features but without a mood episode, right? More specifically, schizoaffective disorder can be distinguished from a major depressive or bipolar disorder with psychotic features based on the presence. Yeah, that's basically what I was saying, Kuti. The 2-week period is important. Like, if there's a 2-week period with psychosis but no mood episodes, then it's schizoaffective. It's definitely not bipolar, and it's definitely not major depression. In contrast, in depressive or bipolar disorder with psychotic features, the psychotic features only occur during the mood episodes. Yes, schizoaffective, they occur separately because the relative portion of mood to psychotic symptoms may change over time. The appropriate diagnosis may change from and to schizoaffective disorder. So like I said, it's a play, you know, between mood and psychotic. But what you need to understand is the mood is the foundation. The mood is the foundation, right? Then the psychotic features like kind of help build it up to, is it schizoaffective disorder or is it actually something else, right? Comorbidity. So many individuals diagnosed with schizoaffective disorder may also have other mental disorders, especially substance use disorders and anxiety disorders. So yeah, you just have to be careful, because remember how one of the, I think the D part of the diagnostic criteria is whatever's happening to the person should not be attributed to substances and stuff. Otherwise, it just becomes a separate diagnosis. Okay, so yeah, that's me trying to summarize schizoaffective disorder. And if you are struggling to understand it like I was, I hope it's a bit more clearer now. Thanks for watching.